right, so now we're going to get into our foot, doing some light footwork. Going to start with a ball. Now I got a lacrosse ball. Lacrosse ball is super firm. I would start with something a little softer, like a tennis ball or a racket ball. But we're just going to do a little bit of soft work on the plantar fascia of the feet. Starting out, I'm just placing the ball of the big toe on top of the ball, kind of right at the bony prominence of that joint. And then I'm just going to let my foot slide forward about a half an inch to where that ball is now kind of in that nice meaty space just at the base of the big toe, getting into that nice musculature. Might be a little sensitive right off the bat. And from here, I'm just going to let the weight of my leg be gravity, creating light pressure. I'm not pushing my foot down. I'm not mashing. I want melt. I want to think of that ball as a hot knife. The bottom of my foot is melting butter, and I just want to feel the butter melt. If you're finding spots that are sensitive, I want to stay on the non-painful side. I want it in that like level 1, level 2, where it hurts in a good way. It doesn't hurt in a way in which you're bracing and really trying to fight it. So it should be like a, feel good massage, not painful. If you can't breathe through it, if you can't melt through it, you have too much pressure. You need to back off. Now, as you're putting pressure on it, you should notice that melting, whatever sensitivity, within about 30 to 90 seconds, it starts to reduce, starts to melt, at which point we're going to move. Staying at that base of the big toe, we're now going to let it move a little bit more towards the heel. But I'm still staying on that line of the big toe for right now. I'm just kind of feeling, is there another spot in there that's sensitive? And if you can find that spot, we're going to stay on it, let it melt, get about a 30 to 40% reduction in that discomfort. I don't want 100% melt, but just a little bit of a melt. And then we're going to move to the next spot of the foot. So after already we should be getting some decent melting. So now I'm going to move the ball to the base, to the joint of the second and third toes of the ball of the foot. Again, kind of at the toe joint, and then a little bit below that where we get into that nice meaty part of the arch of the foot. We're going to do the exact same thing. We're just looking for 1 or 2 spots to get a little bit of soft work, 30 to 40% reduction, melt. And again, if you notice that it's sensitive, then that's kind of what we want to seek out. But I don't want it to be so painful that you can't breathe. Full slow inhale, full slow exhale. If you feel your breath kind of tighten up, then it's too much pressure. And once we get a little bit of a melt through that middle part of the foot, we're now going to go out to the 4th and 5th toes. Again, at the joint of the foot, the toes, the ball of the foot. Move a little bit south of that till we get into the meat of the lateral arch of the foot. So we're more on the outside edge of the arch of the foot and doing the same thing. Just finding where it feels kind of good and sensitive. I find the lateral foot, it's a little bit lower, more towards the heel where it feels that, kind of juiciness. But you might find it's more towards the knuckle of the foot as well. And once we get that same 30 to 40% melt on this side, we're going to switch and do the same thing on the other foot. So starting at the base of the big toe, working just a little bit south, getting into that nice meat of that muscle right at the base of the big toe. Usually that's the most sensitive spot, so I like to start there. Notice as we're getting into this foot, is this foot more or less sensitive than the other foot? And is it more or less sensitive in different parts of the foot? That can be helpful, especially when dealing with certain types of pain. What's going on in your hips is also going on in your feet. So your feet can be give you some interesting feedback. If the feet are really tight through one part of the foot, that might be related to specific tightness in one part of the hip. So as we're working through this first line, kind of noticing how it feels compared to the other side, and then we'll move to that second and third toe line, starting at the knuckle and then working just south of that, getting into the meat of the muscle. Again, kind of noticing if this side's a little more or less sensitive than the other side. Now we're doing about 3 or so minutes on each foot. If you're doing this on your own, it is okay to go a little bit longer. You can spend a little bit more time in each section. I would still keep it to 30 to 90 seconds on each individual spot, getting the 30 to 40% reduction in the melt. But you can find more spots. You can work more areas of the foot in order to get a little bit more mobilization work. I'm now moving to the fourth and fifth knuckles on this foot. And I'm finding my left foot just feels a little bit tighter than my right foot, sensitivity wise, which is interesting because my right foot, the ball of my foot, has actually been dealing with some joint pain, probably joint pain and or arthritis pain of my own related to issues in my right knee. But my left foot is more sensitive on the ball than my right foot is. I actually think that the biggest issue with my right foot is it's too mobile. It's hypermobile, especially at the knuckles of the foot, and that puts more stress on the joints. And it's actually my left foot that is not mobile enough. So as we're starting to get that nice melt and softening, we're then going to set the ball off to the side. And now we're going to do some just simple foot and foot mobility. So again, this is we're working with somebody with a hip replacement. So hip mobility is going to be highly limited. My mobility is going to be greater. So I want you to make sure that you are moving within what your comfort range is. I don't want to trigger any pain over a level 3, especially related to the hip. What's really, really important here is that the nervous system is getting movement, mobility that doesn't trigger into pain responses. So we want to keep that pain level low in order to give your nervous system a good experience of movement. It's going to be really important as far as getting to a point where we're moving pain-free. Our therapeutic movement has to be pain-free if you want your non-therapeutic movement to be relatively pain-free as well. So we're going to start one foot at a time. And we're just simply starting with light ankle rolls. I'm rolling my foot to the outside edge. Knee's going to have to move a little bit, and then rolling it back to the midline foot and seeing if I can get to the inside edge of the foot and then roll to the outside edge of the foot. And I'm seeing if I can get as much roll of the ankle with minimal knee. I don't want to really turn that knee a whole lot. If I turn the knee a whole lot, I can get a lot more movement at the foot. But again, I'm limited in the hip mobility right now. So this is going to be a small movement. I'm trying to get more at the ankle than I am at the knee and the hip. Now, as we're getting into that side to side, we're going to add a little bit more action to it. So as you roll to the outside edge, we're going to lightly lift the heel. So I'm pushing more to the outside edge of the foot. Bringing it down, we're moving to the inside edge of the foot. Outside edge is kind of coming up, and now we're pressing through the ball of the foot. We're just working back and forth lightly. This is subtle work. This is not deep work. We are simply trying to get some light mobility into the joints of the foot. Once we get a good 5 to 10 on just those side-to-side ankle rolls with the ankle lifts, now we're going to let the foot come nice and flat to the floor, and we're going to work on some toe lifts. So starting out, I'm only going to lift my big toe, and I want the other 4 toes lightly pressed into the floor. So Feel the big toe lift to the ceiling and then let it reach back down to the floor. And we're just going to do 5 to 10 nice lifts, slow lifts. Now, as you lift the big toe, try to keep the other four toes engaged with the floor, but without crunching them, without pulling them in, without squeezing them tighter. You might find that that's actually really, really difficult to do. Now, after we do 5 up to 10 big toe lifts, we're now going to plant the big toe and we're going to lift the other four toes separate while keeping that big toe planted. Then bringing it back down and nice slow lift. And again, try to keep the big toe engaged to the floor, but without shortening it, without pulling it in towards the foot. You might find one of these is really difficult to do. It might be more difficult to pull the big toe up. It might be more difficult to pull the other four toes up. When you're pulling those other four toes up, you might find that one or two toes lifts and the other ones don't really move a whole lot. And that's going to be important to kind of pay attention to. So once we got our 5 to 10 on that foot, we're going to now switch to the other side, starting with our just light little ankle rolls side to side. Now, because we're looking at hip replacement, more than likely one hip is moving a little bit better than the other, but I still want to try to limit the hip and the knee movement so that we're getting as much movement through the ankle. And I want to kind of pay attention to stuff. Something I am now noticing on this left side. When I was on the bottom of the foot with the ball, my left foot was a little more sensitive, felt tighter. As I'm getting into this ankle roll, I cannot roll my left ankle as much to the outside edge as I could on my right ankle. It's a lot more tighter and restricted. So that's actually really helpful feedback. More than likely, what's happening, if I can't roll to the outside of this foot, it's pushing me onto my right foot more specifically to those knuckles of the foot where I've actually got a lot more pain. So this might be an interesting tell as far as why my right foot hurts. It might be my left foot. So now we're going to add in ankle lifts. As you roll to one side, press the ankle up to the floor, bring it back down, roll to the other side, lift up through the floor. Working on that outside edge. And again, this just feels a lot tighter on this foot. So where you're feeling tight immobility that is different on one side is going to be a big factor in where you are probably experiencing pain somewhere else. So it's why where it hurts is not always where the problem is. And so we've got to look at the rest of the body, how the rest of the body is moving. Once we get 5 to 10 of our rolls and our lifts, now we're getting our toe lifts, starting with lifting the big toe, keeping the other four toes planted, and then letting the big toe back down. Again, try not to scrunch or pull too hard. I want the toes grounded, but not shortening. If you feel see the short toes shrinking into your foot, then see if you can keep them pressed down, but keep them long. You might find that it's more difficult on this foot than it was on the other foot. Once we get our big toe lifts, now we're going to keep the big toe planted and lifting those other four toes. Keep that big toe planted into the floor without shortening it. Again, I want to feel it grounded as you lift those other toes up to the ceiling. Again, is this harder? Is it more difficult on this side than it was on the other side? And once you get 5 to 10 of those, now we're going to go ahead and get our towel or our washcloth. I got just a small little regular washcloth. I'm putting it down in a nice square. and then I'm putting my foot, my toes right at the very edge of the base of the towel. And I want to keep my heel on the ground. I don't want my foot to move or slide around. The goal here is I'm going to slowly pull the towel, the end of the towel, towards my foot. And I got my foot lined up right in the middle of the towel because as I pull, I want to pull a little bit more to the left or to the big toe side of the corner of the towel. And then I also want to pull from the pinky toe side of the towel. So feel more pull coming from the big toes and then a little bit more coming from the little toes. And see if you can grab the towel and pull it closer and closer to the foot until you got the entire towel underneath that foot. Now I find I am on a mat. This towel does not slide very well. It's actually a little challenging. So I'm getting a little bit more work than I did when I first did this, where I was on a different surface. So if you're doing this on like a carpet or a wood floor or concrete floor, this is probably going to be a little easier than if you're on a mat. Once we're done with one foot, we're going to do the same thing on the other foot. Again, starting at the base of the towel, slowly grab and pull. And remember, I want to pull from the big toe corner side, see if I can get that side pulled in. And I want to pull from the pinky toe side. I'm trying to side. You might notice that it's easier to pull from the big toe. It might be easier to pull from the pinky toe. That might be different on one foot compared to the other foot. And again, that's really valuable information. If one foot has better dexterity to grab and pull that towel than the other foot, then you can imagine that when you walk or balance or do any kind of specialized skill work on one foot, it's a little bit different on that other foot. The other foot's probably not able to do it as well. And those are going to be kind of the areas in which I really want to have balance on both sides.